lives. As part of our focus on building a better Bay Area, we're looking at how coronavirus is affecting people's long-term health, including our mental health. Today, we're shining a light on the issue of suicide, so people can get help and hear the message that you are not alone. We want you or your loved ones to get help if you need it, which is why we're keeping information on how to do that on the screen while this story airs. ABC 7 News reporter Amy Hollifield is live in Walnut Creek, where doctors at John Muir Medical Center are sounding the alarm. Amy?
Hi, Kristen. Yeah, the head of the trauma department here told me he thinks it's time to end the shelter-in-place order. The team here is speaking out now because they say we cannot ignore the rise that they have seen in suicides. Staying at home helped flatten the curve. And because of our efforts, Bay Area medical teams say hospitals have not been overwhelmed by COVID-19 cases. But they have been surprised by something else, a sharp rise in suicides.
The numbers that we've seen are sort of unprecedented. We've never seen numbers like this in such a short period of time. I mean, we've seen a year's worth of suicide attempts in the last 4 weeks.
It has shocked even longtime employees. Casey Hansen has worked as a trauma nurse at John Muir Medical Center in Walnut Creek for almost 33 years.
What I've seen recently, I've never seen before. I've never seen so much intentional injury.
The trauma team here says they are mostly seeing young adults die by suicide. They are worried about the mounting effects of loneliness and job loss as this quarantine continues.
The social isolation has a price, and I know, why we've done it. It just has a bigger price tag than even I thought it would have.
They decided to speak out to inform the community and encourage us to watch out for each other and to get help.
People are there 24/7. We have staff and volunteers ready to answer those calls. Everything is free and confidential.
Tom Tamura is the executive director at the Contra Costa County Crisis Center. He says calls to their hotline are up, but not dramatically. Possibly, he says, because people aren't seeing their regular support network, those who would normally encourage them to call.
I think people found themselves disconnected from the normal social and supportive networks that they have, churches and schools and book clubs, you name it.
I can understand that.
He says with help comes hope, and that a call to 1-800-273-TALK can make a huge difference.
Generally speaking, the vast majority of people believe that they feel better after they call and that they get to resources that they need.
Doctors agree a call to a hotline is crucial right now. Not only are they seeing more suicide attempts, they say they are not able to save as many patients as usual.
They intend to die. And sometimes people will make what we call a gesture, meaning that it's a cry for help a lot of times, and we're able to help them. And we're just seeing something a little different from that right now, and it's upsetting.
Dr. Dubois Blanc thinks this shows the county needs to end the shelter-in-place order.
Well, I think mental health is definitely suffering, and we have unfortunately the data to prove it. It's definitely had an effect. Personally, I think it's time.
The county health department points out sheltering in place is saving lives. And as for the call to end it, officials at the county say it's not uncommon for medical professionals to disagree and have different opinions. They say they will be looking at the science of their indicators as they determine how they will move forward. Right now, that shelter-in-place order is set to expire at 11:59 p.m. on May the 31st, so about another week and a half. Reporting live in Walnut Creek, Amy Hollifield, ABC 7 News.